us. Today's November 15th. We have a very, very special guest. We're very honored to have Dr. Howard Francis here this morning, virtually from Durham, North Carolina. So he's currently the Richard Hall Cheney Senior Professor of Otolaryngology and inaugural chair of the Department of Head and Neck Surgery and Communication Sciences at Duke University Medical Center, where he also serves as the Chief of Medical Staff. So he, after completing high school in Jamaica, he did his bachelor's at University of Southern California in Los Angeles. And then he earned his medical degree at Harvard, MIT, followed by internship residency and fellowship in neurology at Johns Hopkins Hospital. He also completed master's in MBA at Johns Hopkins Carey Business School. And I met Dr. Francis as a resident or as a medical student, where he was the residency program director for 19 years before joining Duke University as the chief initially, and then now the chair, the first chair of the department there in 2019. So he's a well-renowned neurologist and a leader in the field, and also one of the best educators that I know. And so thank you so much. We're so honored that you're here, and he's going to be talking to us about core principles in the age of value.
Thank you, Jamie, for this invitation, for that kind introduction. Can you hear me clearly?
Yes.
Am I coming through clearly? Okay, good. I'm, this is special. You were actually a member of the first class of residents whom I matched as a new program director, and so it means a great deal to be here and to see the work that you're doing. I wish I could learn, and I'm looking forward to learning more about what you are doing there. I'm sure you're making major contributions. Patrick Byrne, my partner in crime as junior faculty, we came up together at Johns Hopkins, and I'm so incredibly proud of you, Patrick, for the work that you're doing as well. Call out to Troy Woodard, who was a medical student at Hopkins when I was a junior faculty, and we had many conversations about his aspirations as he made, I think, a switch from neurosurgery to otolaryngology at last, sort of late, and obviously he's making important contributions to the field now as the president-elect of the Academy and in his academic work and mentorship work. And then Dane Genther, who is another resident who I had the pleasure of working with. So many people, and there are others who have crossed paths with over the years. As you get older, it's not a big specialty. So we get to meet a lot of you, and I think we enjoy each other's company. So I was asked to give a talk about my approach to leadership. And when I give these talks, I always feel a little bit self-conscious because I don't consider myself as a master leader or someone who has mastered the skills of leadership. This is very much a steep learning curve. And because things are changing around us, it's particularly important that we are open, humble enough to spend time on reflection and preparing our junior faculty or trainees for what is to come, so that they can maintain a sustained effort in the contributions that we all need to make. So we certainly are experiencing an unprecedented scope and pace of change that has led to diminishing departmental autonomy and greater attention to shrinking resources and greater emphasis on clinical productivity. And these are major changes that we've seen certainly in our careers and are accelerating. The growing mismatch between professional expectations as academic physicians and a perceived shrinkage of time and bandwidth, as well as resources for academic pursuits, has engendered varying levels of uncertainty, cynicism, and even hopelessness. And I hope that that's not the case in your department, but we all are at different phases or stages or along that continuum. Some of this gap results from insufficient communication about what is really happening at a health system and departmental level and why it's happening. And so left to our own devices, the remaining void is a breeding ground for alternative narratives and growing dissociation from a sense of shared mission. And I think that this is the challenge that we all have as leaders of teams, leaders of programs, and leaders of departments. Is really how we preserve the engagement and maintain the engagement of our team members as we all pull in the same, hopefully in the same direction. So this is broadly speaking what it is that I will try to cover in the remaining time. So we have taken it for granted that patients consider themselves fortunate to be seen at our venerable academic medical centers. Things have changed. Major payers and US companies are desperate to slow rising costs. Private equity firms see an opportunity to deliver cost-effective care and make a reasonable profit, particularly by targeting the healthiest and most affluent pockets of the industry and population. Payers, including CMS, place far less value on the academic mission now, and consumers are increasingly driven by convenience, peer opinion, and perceived value over legacy. Academic medical centers have responded by centralizing resources and restricting departmental autonomy, while forming new external partnerships to achieve economies of scale and to expand populations served. These are trends that we have happening around us. Quality is now valued over quantity as we continue to move from a fee-for-service reality to various degrees of value-based care, ranging from bundle payment for an episode of care to accountability for the health of a whole population. In both instances, cost savings are shared between the health system and payer, and we are evolving to also sharing unexpected costs. And this is a trend that we encountered 5 years ago for the first time. Blue Cross Blue Shield made the declaration that really all of their patients would eventually be managed in the context of a population rather than as individual episodes of care. It's worthwhile reminding ourselves that value is really, that ratio, some ratio that involves quality and service and quantity of service to some degree, but quality being very important relative to cost. And that what we're being held to is maintaining our costs and quality as close to some expected value. The further we move away from that, those expected values of quality and cost, the more we either earn or the more we pay. And this is the projected rate at which value-based care, the approach of value-based care will grow. And we've seen Black pay for performance, which remains relatively stable, and for us probably might continue to grow a little bit more so than for, let's say, the cardiologists, but nevertheless not at the same pace that it has in the past. What we're seeing growing, however, is the patient sort of centered medical home, the number of patients that are within a medical home, the number of patients that we're going to be taking care of where we are being held accountable to some level of quality and cost. And that's growing at maybe somewhere around 8% annually. So we have had a healthcare system in which innovations have focused on new therapies, but we also see high variability in health outcomes, and that's part of the issue that we need to address. We're now about 20% of our GDP is committed to healthcare costs, and that is problematic because we're definitely way and above our peers. With increasing focus on health outcome at the population level rather than solely health care outcome, the difference there is important. We have discovered that over half of the variability can be explained not by the medical care that we deliver, but by the cumulative impact of day-to-day realities of people, so-called social determinants of health, with environmental factors also playing an additional role. Structural inequities that lead to racial disparities make up a significant proportion of the variability in health outcomes and associated costs to the health system. Payment models that reward cost-effective management of health and delivery of health care must therefore address social determinants of health and the persistent burden of inequity. We're therefore seeing an accelerated embrace of social accountability and community engagement as a core mission of academic medical centers, and with it, an increasing focus on addressing inequality and other factors related to social determinants of health. And academic medical centers are certainly uniquely positioned to innovate and advance the health of populations for the reasons listed here. You know, we have this tradition of transdisciplinary collaboration. We exist as integrated and interprofessional teams with strong community connections that we should leverage. And certainly 75% of the academic medical centers are actually located in underserved communities. We're certainly dominant contributors to local and regional economic health and development, major employers for the populations around us. And we have a societal obligation. Let's face it, we have a moral and ethical contract certainly with outsized influence and impact. We've had certainly disproportionately benefited from public funds and regulatory exceptions made to us. And so we have some payback here that is due. Our value proposition is that we are innovators, and we believe that this innovation can improve population health. And I think it's reflected now in this transition from a tripartite mission where, we grew up with the idea that we're doing research, education, and clinical care, and, that's it, we go home, that's it. It turns out that we, now need to integrate into those three our social accountability. And this is something that we're seeing emerge, and something that we actually can leverage as otolaryngologists. As the realities of racial health disparities and structural racism have come into increasing focus, so have the failings of our healthcare system to consistently deliver the promise of better health across a diverse population. As learning communities, have we been too self-assured that we were acting in the best interests of the populations we served? Have we as a specialty thought enough about the health of populations whom we serve and the barriers that affect their timely presentation and appropriate management on their health journeys before they even come to us? Value-based care is providing an opportunity to recast our approach to the academic mission and certainly close the deal that we have made with society to extend innovation not only to the tertiary care bedside, but also to primary care and other community spaces where health is maintained and disease prevented and detected. And this is true for head and neck cancers, hearing loss, and associated morbidities, pediatric disorders, and the list goes on. And this is reflected then in our sort of effort as a department, for example, to extend our reach beyond research alone, patient care alone, leadership development or education alone, to really integrate and make every effort to use a community engagement lens to understand what is happening at the level of the community, what their priorities are, and try to, as best we can, bridge the gaps that are really the source of much of our disparities. I believe that this is actually, there's a silver lining around this, and we're a little bit in crisis, but we should certainly not waste this crisis. I believe that this is an exciting time to be starting one's career, or to lead initiatives that will help our organizations succeed in the face of an unprecedented scope and pace of change. As incentives are more aligned with health and healthcare outcomes, our academic medical centers are by necessity becoming far more integrated to capture more lives, better manage limited resources, and better coordinate patient care. This means giving up some autonomy, but it also means having a greater understanding of the social constructs of disease, which increasingly aligns with health system priorities. Our skill set includes the scientific method, which can impact practice locally, as well as community health and patient outcomes beyond our institutions. And this includes a more intentional effort to understand why pockets of our society have healthcare statistics that don't reflect the cost and possibilities of American medicine. Physician wellness and fulfillment has emerged as an area of need with tremendous opportunities for further development. And we are now more appreciative than ever of the need to provide our nursing colleagues the respect and resources that they deserve and truly partner with them in this great goal that we have. Promoting resilience, and here, I'm going to transition into how I sort of think about how we move forward, given what I just talked about. And I think some of this gets really to the issue of resilience, which is achieved if we have a sense of purpose and belonging, and we understand and value, in fact, what it is that we bring to the table. So here, value has a different meaning, but it has a very strong, important relevance to the discussion. So promoting resilience and grit in the face of uncertainty rides on our ability to preserve and grow a strong sense of purpose and belonging in the context of our work lives. As we come to academic medicine in various states of de-differentiation, mentorship, coaching, and sponsorship are critical to helping crystallize each individual's unique sense of mission or purpose. But the organization must also clearly articulate its big P purpose, right? So there's our individual purpose, but then the organization has to articulate this sense of why are we doing what we're doing. Belonging emerges when we can find alignment as much as possible between individuals' purpose and the institution's purpose, and requires a supportive work culture and some core leadership principles. As we rethink how to fulfill our missions in the face of unprecedented change, it is increasingly necessary to cultivate and align the intellectual capacity and commitment of our interprofessional and interdisciplinary teams. I'd like to share some of the principles that I have found helpful in my 6-year journey so far of leading a new department, which is really built on experiences over the previous 18 years as a faculty member at Johns Hopkins. And I'd break this down into the 3 areas as listed here, and really activating the full value of our faculty, trainees, and staff, cultivating successful teams, and then getting our heads in the right mindset about why we're doing all of this. So we must empower our most valuable asset, our faculty, trainees, and staff. And to do this, there is the first, the need to understand and maximize the value of what we do as in these roles. We need to align talents and passions with needed spheres of innovation, and then we need to acknowledge and honor unique experiences and perspectives that really bring important perspectives to the problems that we're trying to solve. And so I'd like to propose that really this just sort of is a schematic of what I think we are doing in this setting of innovation, healthcare innovation, in our academic roles. Certainly, we come out of a training program with very solid sense of what acceptable standard or common practice is. But in our roles as academic physicians, we're delivering that at the highest level, but we're also trying to refine and define best practice. And then there is this final stage of really, well, how do we then make sure that advances health in the communities that we serve and the communities well beyond where we serve through the actions of our research and the impact of our policy, the policies that we influence, and through the work of our trainees. Well, there are many different pathways for contribution that are absolutely critical to this, and I'm just sort of listing some of these pathways and the various components of them. There isn't enough time to go through all of them, but you see the diversity of contributions that can be made based on the skill set, passion, talent, and commitment of our various faculty members and staff members and trainees. So we want individuals to bring their best selves to this enterprise, and this may involve helping each individual recognize or rediscover even and cultivate their talents and passions, even those formative ones outside of the otolaryngology discipline. And we sometimes let those go to our detriment, not recognizing that those were either practices or skill sets or aspirations that brought us along this really tough road to where we are. We really don't want to waste those. So we want to value our faculty to value their unique life experiences, and we want to help them do that. Identifying how they can be applied to needed spheres of service and innovation should also be part of what we are trying to do. We also need to facilitate the acquisition of complementary skills and collaborative partnerships across disciplinary and functional boundaries to amplify individual contributions to the broader mission. Upon reflection of my own career, it is worthwhile investing the time to discover and develop one's own roadmap for contribution and innovation. And the roadmap does not have to be perfect. One just has to get on, establish where one starts, where one wants to start, and then update that roadmap as we go. Chasing someone else's dream may not be fulfilling or sustainable in the long run. We often only believe what we see, but the road is not straight, and we must access an inner wisdom about how we want to contribute to better healthcare outcomes, healthier communities, and a better world. The transition to a truly self-generated career path can be arduous and takes faith, but is worthy of investment through mentorship, coaching, and seeking new learning experiences. Life is a journey, not a destination. Wonderful quote by Ralph Waldo Emerson. One has to intentionally integrate learning into the journey in order to fully leverage these opportunities, not only cognitive and technical, but also in terms of greater understanding of one's authentic self, which is its own journey, a basic requirement for durability and long-term fulfillment. Time should be taken, possibly with the assistance of some coaching, to recognize latent strengths and motivations that may have been ignored during an intense decade of chasing the next educational and training milestone. To not do so may result in several years of delay making these discoveries and seeking opportunities that are better aligned with one's core strengths. Another famous Waldo Emerson quote is, "To be yourself in a world that is constantly trying to make you something else is the greatest accomplishment, to be yourself in the world." So this is a really, I think, worthwhile TED Talk to look up by Eduardo Briseno. And he speaks about the learning zone and the performance zone. The fact that as we are growing and developing, we need to respect the need to spend some time in the learning zone where we're working on improvement, we're taking risks, and then transferring the lessons to the performance zone, which is the high stakes world that we live in daily. But recognize we need to take that time away from those high stakes activities sometimes to look to grow. So in order to grow, we cannot only live in the performance zone, we need to spend time in low stakes activities that allow us to take risks and learn from our mistakes through feedback and reflection. We should be alternating between the learning and performance zones. And learning needs to target our development as program builders and leaders. Mentorship, coaching, and sponsorship are the levers available to help our trainees and faculty discover and navigate their unique path and contributions. And time in the learning zone, accompanied by feedback and reflection, creates the space for self-discovery that informs how we perform in our career journey. At the same time, care must be taken to recognize and manage our mentors' potential conflicts of interest and impact on our ability to plot our own path forward. Certainly, mentorship is a powerful force that shapes our future and reflects our values. And this includes the need to accommodate greater diversity in the roads taken, to address healthcare inequities and opportunities that have real consequences in terms of disability burden and lives lost. We should be prepared to supplement mentorship structures as they are often unstructured in our department. And it's an ongoing effort in my department to really try and structure that to ensure that we fully help everyone. Because unstructured mentorship tends to disadvantage those individuals who may not be well connected or have access to alternative networks. Furthermore, the perceived need to conform to unstated expectations within the department's culture and discomfort in openly declaring one's authentic interests and goals may direct individuals into pursuits that end in disappointment. And this is a really good paper that was published by Rochelle Walensky while she was at Mass General, where they really looked at nearly 1,000 full-time faculty and the impact of mentorship, structured mentorship, on their career trajectories. And they define a mentor as someone who serves as a career role model and who advises, guides, and promotes his or her mentee's career or training. And they found really strong correlations between the quality of the mentorship, which implies a skill set, and it's a skill set, therefore, that what we have to learn. Relationship between the quality of mentorship and the and how mentees progressed in their APT progress and their level of satisfaction in their jobs. We also need to do a better job mentoring, sponsoring, and supporting women and other underrepresented groups in our field. Certainly, this is a paper and an individual who I would encourage you to read and also potentially invite for a speech presentation. And Dr. Stern has really done a great job highlighting this issue, and it's summarized in the quote here: "Women are underrepresented at the leadership level in surgical departments. Gender homophily is present in collaboration networks among academic surgeons and is associated with impeded female career advancement." To the degree that we can understand these structural disadvantages, we can then address and mitigate them. So mentorship principles, just brought briefly, what is the whole, I think it's very much, there are many different assumptions that we've made about mentorship over the years. And this is not a talk entirely about mentorship, but I encourage you to pursue this as an area of investigation, study, and implementation as a department. But what is your goal as a mentee is the first most important question. Is it a clarification of goals and questions? Is it identification of needed resources to address known goals and questions? Is it a map to map a path and set of milestones towards the goal? It could be to provide structure and accountability because of some difficulties doing so. And then, and then there are other things that have to do with personal life, emotional support, and just how to manage work-life balance, things like this. It's important to realize that these questions are going to change over time, and that mentorship is not static, and it doesn't have to be monolithic either. It can be a mosaic and change over time. How does one choose a mentor? I think generally speaking, the important thing is that you want someone has acceptance, willingness to be accepting and respect the mentee and not try to fix them. There should be defined boundaries around what the mentorship relationship is supposed to, the scope of the mentorship relationship. And if there is a need to change those boundaries, there ought to be an open discussion about whether everyone both agree on that. Certainly be open to the individual should be open to new perspectives. I don't think that identity concordance based on gender and race is a requirement. They're wonderful mentor-mentee relationships where the individuals are very different in different ways. But I think that the previously stated requirements really contribute to the success of that relationship. Beware conflicts of interest, again, important that that's understood. And then finally, exploring alternative models to the traditional mentor-mentee relationship should be considered, and this includes, peer mentorship or affinity group mentorship, and whether it be based on parents or racial minorities or others. And then there are other ways in which we can also see mentorship evolving. And certainly there are many barriers to mentorship across the career continuum that we need to recognize and address. I think that this paper really nicely summarizes many of these issues at different stages of career, and I'd encourage you to consider getting this paper as something to discuss as a group. Also recognize the value of community building activities and structures that preserve a feeling of belonging, peer mentorship, and support. And I think that it's, as we come to recognize that certain activities that in the past were not recognized as being valuable, particularly as they relate to promoting diversity and promoting health equity, that those are activities that are now being recognized by APT committees, and I think allow individuals to show up and be authentic about what they care about and really give their best. So that should be all composed as part of the mentorship process. So none of us has a monopoly on personal challenges, whether intrinsic or extrinsic. We possess tremendous wisdom that we fail to access sometimes because of fear, being overworked or burned out, because of valuing external expectations over our own dreams and aspirations, or the lacking of modeling or knowledge of practices that help us to access this inner wisdom. And I know that there are many people in this audience who are extremely self-assured and knew exactly, and always knew what they wanted to do, and were very successful at doing that. But there are many also individuals who have just incredible talent who are struggling with some of these questions, and that's why I'm talking about it. There are also old psychological traumas or unresolved issues that may lead us to engage in unhealthy work behaviors at the expense of our own mental health. Taking the time to explore these issues with appropriate professionals or coaches, or maybe supervised peer discussions, can be powerful in helping to establish meaning in one's work, sustainable work practices, and better work-life integration. So for example, I'm going to rush through this section because I don't think I have time to really address it, but I participated, I found it helpful to participate in a series of 3 to 4 day retreats over a 2-year period with the same cohort of health professionals. This was known as Courage to Lead, as an example of an activity where the program focused on deep listening, self-inquiry, and reflection to embark on a journey to discover and honor authentic aspirations and understand our impediments really towards seeking greater fulfillment. And part of that activity was what was called a clearness committee, which is a tradition that comes out of the Quaker religious tradition. And I don't think I have time to go into it, but I would direct you, if you're interested in this kind of thing, to the Center for Courage and Renewal. And I put here the website, which really I think has done a nice job trying to tap into our inner wisdom in a way that our traditional mentorship processes don't. And so this sort of is a process that can help us sort of answer some of the questions about really what it is that we care about and what should we be focusing our time on. It's also worthwhile pointing out that there are processes that allow our junior faculty and trainees to support each other as peer mentors. And this is particularly helpful as one seeks to gain clarity about their next steps and provides accountability in following through with self-determined milestones. And so this is a model for peer learning circle that again comes out of the Courage and Renewal group, where a group of 3 to 5 individuals meet for 1 to 2 hours about every month or so. This could be by call, by Zoom, or in person. Each person has 20 minutes to really to present a learning goal for that session. which could either be a request that the others ask them open, really honest questions to try and narrow down to the core issues that they're trying to answer for themselves. Or this could be a time for sharing resources based on very specific goals. There is an effort to maintain a safe and protected space. You have to be vulnerable in this kind of activity, and there are certain rules and touchstones that respect confidentiality, and most importantly, there is a commitment to not trying to fix the person, but only deliver what it is that they want. And so this is something that I have found personally very helpful, and you may want to investigate with colleagues with whom you think you can be open. So in his famous book on becoming a leader, Warren Bennis, I think makes some really important points. It's a great book. A quote that his quotation is, "I cannot stress too much the need for self-invention. To be authentic is literally to be your own author." Which of course has the same root as the word authentic. It's to discover your own native energies and desires, and then to find your own way of acting on them. It is your task to do whatever you must, live up to your potential, to keep the covenant with your youthful dreams. So you certainly are your own best teacher. You have a lot of wisdom, and we don't always know how to access that. We need to accept responsibility, and blaming others is not helpful. You can learn anything you want to learn. You can certainly, true and understanding comes from reflecting on your experience. So this is I'm gonna, as we go through the rest of the talk, just sort of share some other books that I found helpful. Principle number 2 is to cultivate high functioning and innovative teams. We want to take pride in the collective wisdom and capabilities of all of our colleagues. We may be feeling different aspects of the elephant, but if we can listen to each other, we'll eventually figure out that it is an elephant. We want to facilitate development of a healthy work culture, and let's embrace cultural humility, which is a bellwether of excellence. So certainly this starts with, how we select team members. I think that the process, we need to look at the process, and we look at what kind of candidates we're looking for. And certainly we want to seek a diverse applicant pool. That takes work. It takes work to reach into communities that don't necessarily feel comfortable in our spaces, and so having to reach out reaching out can go a far way. And we certainly want to, as we process this diverse pool, want to recognize our intrinsic biases, unconscious biases, certainly eliminate as much as we can any conscious bias, and then mitigate any of the unconscious bias that we know exists. As it relates to the candidate, what is the value added of the candidate to the mission and to the team? And we really want to look for people with a positive track record of collaboration and professionalism. There is nothing more destructive than bringing in someone where we haven't done due diligence around this, and our energies, emotional and otherwise, are really being spent in trying to repair the damage done. In a time of rapid change, previously sacred assumptions must be re-examined, and this requires that our faculty feel psychologically safe, with a sense of belonging that warrants the taking of risks. And I think this book really does a nice job addressing this issue. We want to support authenticity. People who bring themselves and feel their authentic selves are most likely to bring their best ideas and feel free to share those. The safety to bring your whole self to work is what we should aspire to. Failure is okay as long as we learn from it, and we set up the circumstances to minimize the impact of that failure. Really, we want to discourage this idea that perfectionism is a good thing. It actually is not. So to bring one's whole self, there is a certain amount of authenticity and courage that we want people to demonstrate, but this requires that they be vulnerable. to be vulnerable, there needs to be a tremendous amount of empathy in the environment. Without the empathy, the vulnerability becomes a real danger, and it's hard to sustain that. So what do we as leaders, all of us here in this, who have some control over groups, what can we do to promote this kind of these concepts? We certainly can celebrate the lessons that we've learned from our failures, acknowledge our own tendency to fail occasionally, our own fallibility. We want to model curiosity. We don't have all the answers. We want to ask questions, and we want to especially ask for help from our team members, and lead by example in these ways. So as a member of a learning community, we all have shared interests in cultivating a work and learning environment in which we can be collectively creative and innovative. I believe that this is our predominant aspiration and indeed our predominant purpose in academia. Delivering excellent patient care is only the floor, and our ceiling is really the sky. It's what we can imagine. And part of this is increasing tolerance for psychological vulnerability, risk-taking, and reasonable risk-taking and failure. This is difficult. It requires reduced emphasis on achievement and greater value placed on effort, originality, and learning from failure. I think this book does a phenomenal job discussing this. It also requires greater tolerance and even encouragement of respectful dissent, which is the hardest thing. They talk about the minority viewpoint. The minority viewpoints are important, not because they tend to prevail. They may even be wrong sometimes, and the minority viewpoint is just a minority perspective. But because they stimulate divergent attention and thought, even when they are wrong, they contribute to the detection of novel solutions and decisions that, unbalanced, are qualitatively better. We all want to be the brightest person in the room with the right answer. That is not going to get us where we need to go. We need to be able to incrementally talk about, share our ideas, even if they don't end up being adopted, they will direct our thinking process as a group towards a more innovative result. And coming back to this book, talks about the importance of looking at issues related to diversity. So actions that say we're all in this together. We value you for who you are and what you bring. And the question is, what should we do as leaders? We need to acknowledge our bias and privilege, get specific advice, feedback, and education around how to promote an inclusive environment. This is a skill set that we can learn. Mentor and sponsor people, share origin stories, our own stories. All of our stories have meaning and can tell us something about and share something about who we are. Have compassion for each other, be willing to talk authentically, and learn together. There's nothing more clearly that promotes purpose and belonging than empowerment of our teams. And this really requires that the authority stays with the vision, and sort of our frontline groups or faculty or staff really are given the authority to make decisions based on the information that they have access to. And I direct you to this book as well. I won't have time to talk about the Infinite Game, but I encourage you to read it. It's a really great attention to the issues that we are dealing with. I would just suffice it to say that the danger that we live in right now is giving finite goals and metrics greater importance than they deserve. So we really want to lead with vision or just cause, follow with metrics, and then close with a challenge. How do we do better? I want to say that we should celebrate our opportunity to lead a life of impact. We are the luckiest people alive to have the opportunity to engage in topics that we are passionate about that impact people's lives in such significant ways. And we now have this opportunity to work with the health system to really promote health. And we as otolaryngologists, communication scientists, we need to speak up in those rooms and point out that, hey, don't ignore hearing loss, balance disorders, head and neck cancers. These are things that we need to speak up about as it relates to the population health, the health of our population. So certainly we're very lucky, and one of my favorite books is that of By the Dalai Lama and Desmond Tutu. I'm going to wrap up with just pointing out that we need to be intentional about establishing the language and practices that allow the faculty, learners, and staff to articulate our shared purpose and engage in practices that allow us to navigate conflict, mutual support in innovation, and all this stuff. So out of our own program here at Duke, we've developed the Leadership Lived Out since 2013, which consists of discussion forums, 360-degree evaluations, and personal coaching. And this includes faculty, not only of our department, but of our sister and departments with whom we collaborate across institution. We do require our PGY4 residents to participate in this year-long program as they prepare to become chiefs. We have nurses, we have administrative assistants, and it's really based on a construct that is based on these emotional intelligence, leadership intelligence, and cognitive intelligence, and the various ways in which we can learn how to best manage these and leverage these to get the outcomes that we want. We have over 70 participants over a 7-year period. Now 10 years, we have more, and there's been a significant impact. I think that it's really made a difference in how we operated during COVID and how we've handled becoming a new department in COVID in a time of great uncertainty. And I do think it's worthwhile looking at programs like this. So I really appreciate this opportunity I'm hoping to see a good game this coming Friday. These tickets are as rare as hen's teeth, but I was invited by a colleague to attend. So I'm looking forward to another Blue Devils game this Friday, and we'll see what happens there. But really want to say send hellos from Duke and from the team here to you in Cleveland.
Thank you, Dr. Francis. That was such a thought-provoking talk, and it really reflects your journey as not just an individual, but as a leader, mentor, and an educator. So thank you so much. I'm going to open up to questions, please, or comments. Yes.
Howard, that was a fantastic talk. There's a lot packed in there. I've got a page of notes, and I'm glad it's recorded, because honestly, there's really a lot of really good content, especially for so many of us on this call, which is probably most people who aspire to improve our ability to lead and contribute in positive ways. Two topics, maybe you could pick one of them in the interest of time, just to riff on a little bit, or both if you wanted. I'd be curious to hear you expand on a little bit. One was, you mentioned the shift from the tripartite to the quadripartite mission. And I'm not sure I fully grasp it. I'd love to hear maybe a little more of how you think about that. The other one, though, and maybe just pick which one you feel want to expand on. You're uniquely gifted in a lot of the attributes that you presented, the ability to signal vulnerability at the same time as competence and expertise, and help people feel comfortable, etc. A topic that is a difficult one that you didn't choose to address today is that of as a leader having tough conversations and accountability, right? And it may have been implicit, but with the model of leadership that you present and live and your values, any comments on how you think about that piece would also be interested in, I think, for the group.
Thanks for your comments, both of you. And Patrick, thanks for those questions. Are really important questions. And, I think that the discussions addressing your second question first. If there's time, I'll do this first. The second question, I think that it really requires that there is a shared set of values and discussion. So having discussions around what we value and what is important to us, some virtues, if you will, that we can all agree on. What do we value as a community in terms of meeting our goals? And so those virtues that I sort of put up briefly address that a little bit. And having had those discussions, always having, those are our guard posts. Those are the things that we all agree on. Let's, based on let's say an event that occurred with a faculty member. I try to use an SBI sort of a, what was the situation? What and how it impacted, or what was the impact of that behavior, and how does that relate to our virtues, the virtues that we all agree on as being important. So sort of starting out with a sense of common agreement around what we value as a community is important. It's not something that we have done traditionally. I will say that when I arrived at Duke, this was already ongoing, and I must say it is a brilliant, it's been extremely helpful in having these conversations. And first of all, people tend to police each other. They don't always come to me. It's already happening at the ground level. That so I guess that's one. There are many other answers to that questions. I think your first question again was what was it again?
Quadripartite.
Yeah, quadripartite. So that is still evolving for us, but it's clear that we had to start somewhere. Where did we start? In the middle of COVID, we certainly as a community were not able to get together and go have dinner together, but we could show up in a food pantry and work together. And we could actually work together in that setting. It had nothing to do with head and neck, but it had to do with us making a statement that, our communities are, that we belong to them as academic communities. And then that progressed to, okay, each division, I want you to have not only a research, you have certain goals in the other three missions, but how are you going to identify what the community cares about around head and neck cancer, around hearing, and then as even just a needs assessment. Because just because we have great intellectual questions doesn't mean that that's what the community values. Let's say a marginalized community in particular, a community where there is clearly underutilization of hearing interventions. So, those are examples. And then there are several milestones that define traveling through various levels of this mission, that each division is at different stages. And we have one division now that now has a grant that is based on work that they've done with a community of immigrants with a high rate of head and neck cancer. And so I think what comes out of this is our ability to bring into the academic realm issues that have in the past sort of been not valued, but are now part of the health system's efforts to promote population health. So we can start small, but I think what's possible is quite significant.
Thank you.
Well,
Anybody else with questions? If not, I have one specifically. You mentioned, intentionally cultivating like individuals' interests and unique skills to kind of hone in on what they can contribute and innovate. So what does that actually look like? Like, is there a program that's ongoing? Is it how is it structured? How do you actually do that?
yeah, it's not so easy to do, Jamie, but it is doable. And I would say that based on my own journey, that the closest thing we have to this now in our health systems is coaching. That is a process where more questions are asked than declarations are made about what you should do. There are more questions that force you to really think deeper into, well, what is it that is driving me? What is it that I find energizing versus not energizing? What does that mean about maybe ultimately the next step in my career journey? I think that mentorship is particularly more useful when you've had those questions answered. I did mention, there are several individuals who have gone through difficult times in their lives, and they're still processing all those things. And to the degree that they can recognize that and get the necessary therapy they need around that, opens up their opportunity to then also answer those questions. So it's extremely individualized. And I think that the closest thing we have to this is coaching. I think we have to have a low threshold offering coaching to our faculty when we see that they are struggling with this. And so that would be my fastest answer. Yeah. Thank you for these questions, and I look forward to us talking more about these issues. I clearly don't have many answers, but I'm just right now trying to define the questions. And to the degree that I can, with those questions, find some solutions for our people or for individuals, I'm doing the best I can, and I challenge you to do the same. Thanks for this opportunity.